So here we're going to focus on the posterior delt, and we are going to get some of the Teres, some of the Infraspinatous as well, of course. But our main intention here is this big mound of tissue here that's called the posterior deltoid. Okay? Just taking deep breaths already. So use a very little bit of cream, very small amount of lotion. You don't want the skin to be too greasy, too slick. So very small amount of cream when you're applying deep myofascial work. Most of us, when we work the shoulder, the back of the shoulder, we generally, or most therapists that I encounter, always keep the arm in this position or down in here. And that's great, we do that too. But we need to get in the habit of working the body in different positions. So I like to work the back of the shoulder or the posterior cuff in like a figure 4 type position. So you can place the client if they have the mobility like this. So here we're putting Kiki into internal rotation. Most of our clients won't have that, so I'll show you some variations. So I'm going to be here. So by me having my arm on the table like so, it allows me to really manipulate the amount of range of motion, the flexion and the extension. So Kiki's somewhat relaxed here. Lift your elbow 1 sec for me. Relax. So that just allows me to find the posterior cuff. Relax your arm again. Relax it. Just lift 1 inch. So she lifts and this mound of tissue pops up. So I'm going to use a thumb contact initially. So I apply pressure here, somewhat relaxed, and all I'm going to do, I'm going to take Kiki's arm into some flexion and some more internal rotation here. Most of our clients need more shoulder internal rotation, by the way. So the back of the shoulder, the posterior delt, is generally a high horizontal abductor of the shoulder. So in this position, the posterior delt is somewhat shortened. Was okay? Mm-hmm. Okay. Let's do some circles. Nice strong grab. I'm going to use 3 fingers here, guys, and I'm going to rotate and pressure. So now these fingers maintain contact, the pressure, and I come this way. This setup is not ideal. I'll let me come down in here. So I apply pressure, rotate. When I apply pressure and rotate, sometimes it's common, not normal, but common for clients to experience some sort of pinching or posterior shoulder discomfort. This could be a joint capsule issue. It could be a long head of a tricep issue. It could be an infra or supraspinatus impingement. It could be many things, and there are multiple impingements in the back of the shoulder. If that does happen, so if I'm here and Kiki says she feels some sort of pinch or discomfort in her shoulder blade area, what I'll do is as I rotate her, I apply a slight distraction force. I'm pulling this way with this hand, so I'm pulling. So if she is pinching in the back of the shoulder during this technique, I apply finger pressure, I rotate and pull. Feels different? So I rotate and pull. So obviously once I start getting down lower here, now we're no longer on the posterior delt. Now we're getting into like Teres, Infraspinatus, maybe a bit of lat, and this is all fair game. This all needs work. As a rule, when we're working across the grain of the tissue, we're trying to relax them, not necessarily trying to lengthen them. Here. We can do this from multiple angles. I'm going to go back to you for a brief moment, guys. So now I'd use a slightly different hand configuration. So I'll be here. So now my finger pressure is going up to down or down to up. So now it's here. So now these, my left hand, the pressure doesn't really move so much. The movement comes from me rotating Kiki's arm, which therefore rotates the muscle, as opposed to me doing this, which is, again, is okay. This is just a different technique. So my left hand maintains contact, and the movement comes from this motion here. If you're working with a client who's extremely limited in internal rotation, which is going to be most of our clients, what you'll notice is when we take Kiki into movement here, she's really going to protract through her shoulder blades, and that's a common compensation. So when I say to people do this and then really dive forward here, these are the people that normally present to us with like long-headed bicep issues, AC joint issues, some possible neck tension, because they don't have the glenohumeral motion. They get it from scapular protraction and clavicular rotation. So we need to restore basic range of motions in the shoulder joint and most joints for that matter. And we expand upon that more in our Assess and Correct class. So for someone who's very limited, the range of motion may be small. So I may start here, or straighten my leg, it might be here. And the pressure might be like so. And as she gets more range of motion, I'll bend my knee more here. And again, for biomechanics, I'll be back here like so. So if this is her range, we can just come sometimes and sit in this position and hold this for a period of time, 90 seconds, 2 minutes, just to give that joint and these muscles enough time to relax. We can also use this storing action, which I use a lot of. So when we do this, the compensation is this motion. So I can put Kiki's arm into the position that we want, which is internal rotation. And then I'm going to use my other elbow, forearm, to take her back where we want her to go. So it's going to look like this. So we're now soaring down. And this is a great way to decompress the glenohumeral joint. Because as I hook down, we're essentially hooking the bone and we're pushing down this way. And this really creates space in the upper part and forward part of the shoulder. Feels okay? Mm-hmm. So notice what I'm doing here. Internally rotating, I'm slightly pulling her this way. And as I do that, I'm pushing down. Yeah. So it's just like this push-pull. Most of our massage technique, there's always this pushing, pulling relationship going on. Yeah. This is a great way to really work the posterior delt, and just a broad-based technique for the posterior shoulder generally. So this is just a good alternative to just working passively here. Most of us do this type of work already. Some of us come in here and do this type of work already. This just gives an option to add in some range of motion to our work, which we think is very important.